Is the PNS checked during a neurological exam for epilepsy? When you think about epilepsy, most people imagine brain activity and electrical signals. But did you know that during a neurological exam for epilepsy, the peripheral nervous system is also checked? It might surprise you because the main focus is on the brain, but the entire nervous system is evaluated to get a full picture of neurological health. The purpose of a neurological exam in epilepsy is to see how well the brain and nervous system are working overall. Doctors look at mental alertness, cranial nerves that control eye movement and facial sensation, muscle strength, coordination, reflexes, and sensory responses. This helps identify any neurological issues that might be related to seizures or other conditions. Since epilepsy originates from abnormal electrical activity in the brain, tests like the electroencephalogram are used to monitor brain waves directly. But the neurological exam also includes checks on the peripheral nervous system, because peripheral nerves can influence symptoms or point to other neurological problems that might mimic seizures or occur alongside epilepsy. During the exam, doctors test sensory functions by asking patients to feel touch, pain, temperature, and vibrations. These tests assess how well the peripheral nerves are working. Reflex testing is also common. It involves tapping on specific tendons to see if reflexes are normal, which involves both peripheral nerves and the spinal cord. Muscle strength and tone are checked to see if nerves or muscles are affected. Additionally, coordination tests, like touching the nose with eyes closed, partly evaluate sensory pathways that involve peripheral nerves. In some cases, if a patient's history or symptoms suggest peripheral nerve issues like neuropathy or nerve root problems, more detailed testing such as nerve conduction studies might be ordered. But in routine epilepsy evaluations, the focus on the peripheral nervous system is usually limited unless there are signs indicating peripheral nerve involvement. So, to sum it up, the neurological exam for epilepsy does include checking the peripheral nervous system. While the main concern is the brain, assessing peripheral nerves helps provide a complete picture of nervous system health. This comprehensive approach ensures that any other neurological issues are identified, which can influence diagnosis and treatment plans. Remember, always consult a healthcare professional for personalized advice. The extent of nerve testing during an exam depends on individual symptoms and medical history. The goal is to understand the whole nervous system's function to support accurate diagnosis and effective management of epilepsy.